Next presentation is titled Wisconsin Family Physician Perspective on Telehealth Usage by Visit Type During COVID and Beyond. And the lead author is Patrick Vosters from MCW Green Bay campus. Patrick, the floor is yours.
All right, let me see if I can make my presentation a little bit bigger here. I think I'll just start off. So yes, my name is Patrick Vosters. I'm a second-year medical student at MCW Green Bay, and I'm here to present a part of my Physicians in the Community Pathway project. So I'm sure that many of you have heard of telehealth being a way to reduce healthcare costs, but also to maximize healthcare access. However, traditionally, most experts would agree that telehealth hasn't been used as widely as it could or should be. Of course, with the COVID-19 pandemic, usage has really skyrocketed. So my project kind of looks to investigate, how has telehealth changed from before the pandemic to during the pandemic to even after the pandemic. So more formally, the objectives of this project are to assess pandemic-driven changes in telehealth usage by family physicians for 4 visit types. So these visit types are acute illness visits, chronic illness visits, transitional care visits, and wellness check visits. Also, we want to look for family physician opinion on post-pandemic telehealth usage for these same visit types. And lastly, we want to look for differences in response distributions by physician age and also by physician location of practice, so whether that's rural or urban. To collect our data, we designed surveys and sent them out to family physicians through the Wisconsin Academy of Family Physicians. And the surveys, it was designed kind of based on this schematic, where the option choices are, they follow the Likert scale from strongly agree to strongly disagree. And what was agreed or disagreed to were statements that kind of followed this pattern, where I have a time period and a visit type. So for example, during the pandemic, more acute illness visits were conducted using telehealth than before the pandemic. So in this way, we can compare pandemic telehealth usage to pre-pandemic telehealth usage for a specific visit type. Now, if we substitute after for during, then we can compare post-pandemic telehealth usage to pre-pandemic telehealth usage, again, for any of these visit types. So then moving on to the results, the first column here shows the time period comparison of pandemic telehealth usage to pre-pandemic telehealth usage. The second column shows distributions for post-pandemic telehealth usage that should occur, and it compares it to pre-pandemic usage levels. And then each row just shows a different visit type. So as far as data analysis goes, all the distributions in the first column, they were all significant. So all these response distributions were not due to random chance alone. And then the first 2 distributions in the second column were also significant. No significant differences were found by physician age or by physician location of practice. So what does this tell us? The significance in the first column pretty much confirms that for all the different visit types we looked into, there was a pandemic-driven telehealth use increase. The significance in the second column shows us that for acute illness visits and for chronic illness visits, physicians report that there should be increased telehealth usage after the pandemic compared to before. Now, if you look at these 2 distributions in the right-hand column and compare them to the corresponding distributions in the left-hand column, it's pretty clear that the left-hand, the during versus pre-pandemic distributions, there's more robust agreement here. So I think that kind of tells us that the pandemic-driven increase in telehealth probably was a lot larger than what physicians think we should use in the future. So I think that for acute illness visit types and chronic illness visit types in the future, yeah, maybe we should use a little bit more than we have in the past, but definitely not quite to pandemic levels. Other two kind of conclusions that aren't in this poster, we kind of found from the comments section in our survey. And the first of that is that in the rural parts of the state, there still is a lot of limited access to internet, which obviously compromises the use of telehealth in those settings, which are settings that really could benefit from telehealth usage. The second thing that we noted was that physician opinion on telehealth usage really varies widely. Some physicians loved it, some very much did not love it. So it's a work in progress. With that, well, also I want to mention that I think that this framework is good for investigating this question. However, in the future, it would be more useful if we use more specific visit types and also maybe surveyed a more specific like practitioner type. And I think the data in that case would be more specific and more useful. With that, are there any questions?
Great work, Patrick, and such a timely topic for us to be thinking about during COVID, and that is, what does healthcare delivery look like from the perspective of our family physicians across the state? What are the ways in which we've had to pivot, whether we're in community settings or in clinical settings or in education? So I think work like this really speaks to the ways in which we've needed to make those pivots and what's most beneficial and what are the things that we need to think about over time. Have you given some thought doing this work as a student, how you might continue this into the future? As it seems like telehealth has certainly had its benefits during the pandemic. Is this research that you'd like to continue in your medical education?
Yeah, I think I'd be down for it. Kind of like what I said before, I think it would be really interesting in the future to apply this to more specific cases. And kind of like what I was saying before, I think with a greater degree of specificity, it really could be useful in terms of like workflow design or like resource allocation. But yeah, I'd say in the future, if there's an organization that be willing to work with me, I'd definitely continue.
Great work. And, again, I think, part of the reason why I asked the question is, you're certainly in a position, thinking ahead to the, whatever direction you might choose to take in your professional career, that now we know all the different ways that, our work may change or need to change in order to be able to be nimble in different healthcare environments. So I think it's excellent work that you are doing, and thank you for taking advantage of this opportunity in order to engage with physicians across the state to see how they're doing this work during the pandemic. Great.
All right, well, thank you.